Today we're analysing an anomaly in the Australian aged care industry. 2023 ABS census data paints a picture of significant increases in Australia's ageing population now and into the future. Yet while the demand for aged care grows, according to the 2025 KPMG Aged Care Market Analysis Report, the industry continues to face significant financial viability and workforce challenges. This presentation uncovers the major macro-environmental and industry-level drivers of the anomaly that is poor sector performance, despite strong and growing demand, using some strategic analysis tools in the PESTEL and SWOT frameworks and the Porter's 5 forces model. Authors Fine and Davidson describe competition within the industry as being between non-profit, for-profit and government providers. Funding, policy and governance, however, are largely controlled by the Australian government, according to a 2024 scoping study by Sternberg et al. Consultancy firm Stewart Brown's sector report for the 3 quarters to March 2025 revealed roughly 50% of all providers across the sector recorded operating losses, with the Department of Health, Disability and Ageing signalling close to 4% of suppliers exiting the industry over the financial year. According to the Aged and Community Care Association's 2024 sector report, 92% of providers reported that government funding was a major concern. Workforce recruitment and retention to meet aged care recipient needs was a major issue, while almost 84% felt that new regulation and legislative constraints translated to increased industry stress. Supporting these findings, Journal of Public Health authors Al-Said et al. Cite that the major issue facing Australia's aged care sector is indeed financial sustainability and worker shortages. In a 2019 analysis of strategic factors affecting industries, Uliubelli et al. Describes a PESTEL analysis as a key tool for understanding the factors that influence industry, with P, S, and L of the acronym representing political, social, and legal factors. The authors describe political factors as the influence governments have over the industry, social as societal attitudes that affect the industry, and legal as the regulatory or legislative influences. Societal expectations have significantly influenced the aged care sector and somewhat precipitated the political and legal changes also impacting the sector. Sternberg et al. Notes that the industry struggles to live up to the expectations of modern society. The Royal Commission into Aged Care, according to 2020 Grattan Institute report authors Duckett et al., reflected shamefully on the industry, which, according to the findings of a 2020 Grant Thornton report on sector funding and stimulus, adverse media coverage from the Commission also tarnished the attractiveness of the industry for prospective workers. The political impacts on the industry are obvious, with provider revenue predominantly derived from government funding, according to Health Policy Journal authors Yong et al. The authors also cite the impact of the government limiting the number of location of nursing home places. The introduction of minimum staffing levels in 2023 has seen increased expenses for providers, according to the Department of Health, Disability and Ageing, with the KPMG report from the same period identifying that legislative and regulatory reform burden as one of the key drivers forcing providers out of the industry. Mazaroglu and Davut, authors of a 2024 case study on SWOT analysis of health providers, note that the tool allows strategic evaluation of environmental threats. These threats flow quite logically from our PESTEL analysis, with the literature discussed earlier quite clearly indicating that changes in government funding and regulation threaten industry viability. Sternberg et al. Reinforces this, stating that the biggest risk in the sector is borne by providers who must quickly respond at the whim of financial and regulatory changes. Within the industry, we look at sector profitability through the application of bargaining power of suppliers as an element of Porter's 5 forces. According to Porter, powerful suppliers, including labour, have significant ability to impact profitability. When suppliers are concentrated and their offering is not substitutable, they hold significant power. Given aged care work is specialised and therefore not substitutable, and there is a workforce shortage, meaning labour supply is more concentrated, suppliers could be considered quite powerful, thus creating a drag on industry profitability. Lord et al. Further reinforces this in their 2021 analysis of competitive forces impacting nursing homes that found financial distress strongly correlates with resource deficits. In conclusion, this analysis has found poor sector performance despite strong and growing demand in the aged care sector can be attributed to the influence of macro-environmental factors and industry threats, government funding and the impost of changing regulations and legislation uncertainty, societal factors which have in part precipitated the Royal Commission and sector regulatory and legislative reform and impacted industry attractiveness for prospective workers. And lastly, high bargaining power of the aged care workforce, with labour shortages a significant concern.